Welcome to the next session, Theatre One. I'm Colin Mulberg, from Director of Colin Mulberg Consulting, and I'm hosting the theatre today. We are going to be filming this session, so if the noise gets a bit loud from the next theatre or you miss a bit, it should be online after the show. So you'll be able to catch it there. We're leaving about 10 minutes for Q&As at the end, some questions. So if you have any, please put your hand up then and we can do our best to answer. And I'm just going to hand straight over to Victoria, who's going to be talking about well-being. And well-being has been an issue which has come to the fore from the pandemic. Only Doncaster have been doing it for ages, so she's going to be telling us the work on well-being that she's going to be doing. She's been doing at Doncaster, and I'm going to hand over to her to introduce herself.
So, can everyone hear me in my Britney Spears headset? Brilliant. I was just saying, it feels like I should be on Eurovision. I'm very excited. So, I'm Victoria and I work for Heritage Doncaster, and I'm going to be talking to you today about our Heritage and Wellbeing programme, but I'm mostly telling you all the things I did wrong, so please don't hold that against me in the future. So to start with, I'm going to introduce you to Heritage Doncaster. I'm assuming you've all been up to Donny, but for those that haven't, I will give you a brief kind of summary. So, we're the local authority-run heritage organisations in Doncaster. We operate the Dainham Gallery, Library and Museum, which you can see on your screens there. It opened in 2021. We were really fortunate to get some investment from the local authority. We also operate Cusworth Hall and a heritage park, a regimental museum, the Mansion House and an education service. And later on this year, we're opening up a new archives and research centre. Our collections include natural history, social history, costume, archaeology, fine art, decorative arts, as well as archival and local history sources and photographs. But what you're here to listen about is history, health and happiness. This is our outreach wellbeing programme, and we're entering our 5th year of programming. We're funded by Arts Council England as part of their national portfolio, and our programme aims to use collections and storytelling to spark conversation, improve well-being and tackle isolation. So really simply put, we use history to enable people to feel good about themselves and where they live. We work with vulnerable and isolated adults, families and young people. And all of our activities take place outside of our museum spaces. We put on activities pretty much where anyone will have us, but that includes libraries, community halls, parks, family hubs, and any social space around the borough. Our activities include things like social clubs, outdoor cooking courses, make, do and mend sessions, under fives clubs, and I'll give some more detailed examples later. We're really keen to anchor ourselves as part of Doncaster's community, and we work with the communities to kind of establish what it is that they want. So that all of our activities have co-production at their heart, and they respond to the real needs and wants of the audiences we work with. It means that our activities look really different across the borough. There's no lift and shift. We deliver our activities independently, but we also work in partnership with other organisations. The really exciting thing for us is that our communities work has just been embedded as a core service. So from 2023, it means we'll no longer be reliant on grant funding for this part of our work, which is really brilliant. Our work is evaluated by academics, which is something I'll talk a bit about later. There's lots that went wrong there. So our work is evaluated by academics from Sheffield Hallam University and ARC Research. So because of that, we're able to produce really whizzy infographics like the one on the screen that shows you that our work is valuable and having a real and meaningful difference to the lives of people in Doncaster. Our evaluators have found that our digital social clubs enable people to make friends, develop skills, and improve well-being. And people who come to those clubs have a 20% increase in interest in new things, which is a key marker of increased mental health scores. But beyond that, what is the human impact of our work? So on the screen is, you probably can't see it from where you're sitting in detail, but it's a case study about a lady called Marie. Marie started coming to our sessions during the pandemic, and my favourite thing that she said, completely without prompting, is that because of our sessions, she refound her sparkle. So it's case studies like this that really show the impact of our work. The stats are lovely, but this is way better. So I'm going to quickly introduce you to a few of our programs so you can get a sense of what it is we actually do. So the first is a group called Her Story. So this is a group for roughly working-aged women in Dennerby, Maine, which is a former pit village in Doncaster. The group was born out of a desire for younger people who were feeling isolated to have something to go to. Most of the things in their community were aimed at people that were retired and were almost exclusively bingo. So this group started in 2018, and the selling point was come to 8 sessions and we'll take you to London. So many of the women who joined us admitted that was the big sell. They'd never been to London. It was amazing they got to go. But almost, 4 years later, they're still coming. So something's working. The group continues to meet now, and each week they explore the lives of women in the past, and they work out whether or not they'd like to go to the pub with them, basically. We do crafts, we do cooking, storytelling. The second group is a group called the History Book Club. It was formed during the pandemic, and it's an online group that meets fortnightly. One week they explore a topic in the past, so they look at objects from our collection, share some stories, and then the following week they've read a book on the same theme and they talk about it. They work out whether it was historically accurate and kind of have a big discussion. The group's got really varied participants, including those who are fitting these sessions in around their lunch break, around caring, and those that are just really avid readers that will read anything you put in front of them. This group is currently experimenting with a hybrid model, so it's moving to some in-person sessions to fulfill those needs. Another example is Taste of History. So this is a collaboration with the Yorkshire Wildlife Trust, and it's aimed at adults experiencing loneliness. It's a 6-week course that's run in blocks throughout the year, and the group meets and explores the past through our collections, and then they have a go at cooking a historical recipe on an open fire. And they sometimes go foraging and collect things they're going to cook in the park as well. And the final example is Curiosity Club. So this is our newest venture. It's an under 5s program in Woodlands, which is another pit village. And parents, carers, and their under 5s come along and explore history through messy play, storytelling, and our collections. This session came out of lots and lots and lots of piloting and plenty of time working out what was needed to run this session effectively. We run loads of other things, but that's just a taster of what we do. So for the next part of the session, I'm going to expose myself and talk about all the things that I did wrong. I'm going to kind of talk through how we came up with History, Health and Happiness and what we did. So first of all, we had to work out who we were going to work with and really crucially what they actually wanted us to do. We knew anecdotally that our work was having an impact on people's lives and that they were experiencing improvements in mood and well-being as a result of the activities we were running. The data was all there, we could see it happening. But we also knew that for us, the biggest barrier in Doncaster is transport. It's the biggest metropolitan borough in the UK, and public transport is a bit naff, to say the least. It's also really expensive, it's not always convenient, and our community transport is completely overrun. We also wanted people to be able to have meaningful interactions with us and feel really, really comfortable. So for us, the answer was always going to be outreach activities. It was always going to be our answer. So to establish where we would base our work, because it is the biggest metropolitan borough in the UK, we set about collecting loads of data. I'm someone that loves statistics. If you're not, get someone else to do it. But we went through loads and loads and loads of bits of material. mostly the joint strategic needs assessments and those kind of medical documents, to work out what those biggest health issues were in the borough and which areas were most affected by those health issues. We'd also gathered stats on deprivation, and we used our visitor surveys to work out who wasn't visiting us and kind of triangulated all those points and identified areas of the borough we wanted to work in. It chucked up loads of areas in the borough, and we had to be really realistic. At the time, we were a team of 2, so I had to work out where we were going to be able to work most meaningfully, so we picked 4 areas. Once we'd identified those areas, we then needed to begin to understand who was there and what they wanted. And the biggest tip I can give you here is not to underestimate the time it takes to identify your audiences and their needs. It will take lots of cups of tea, lots of meetings, and in my case, lots of visits to pit clubs across the borough. We sought out community anchors. So those were the people who everyone told us we had to talk to. But these people were also really time poor because everyone was telling everyone to go and talk to them. They were often also really wary of new projects because they'd been promised the earth and people hadn't delivered. So we're really mindful of this burden, and in some cases we compensated community anchors for their insight and expertise as we would do any other consultant. We also made efforts to track out people who weren't the usual suspects and to learn ourselves by offering one-off sessions to existing groups to talk to those who attended. Building trust was really important, and for many community partners and anchors, they had loads of experiences of being let down. So we needed to take the time to develop that relationship and demonstrate that we really would deliver. We had to be really clear about what we could and crucially couldn't do, and establish a rapport with the community. We didn't promise anything that we wouldn't be able to action. It's been easier in some areas than others to build a picture of that community, and COVID has had a huge impact on this. We know that our communities aren't the same as they were in 2019, and in some cases we've lost a lot of those community anchors. They simply aren't there anymore. So we're having to do some of this work again from scratch, and I'm really mindful of the time it takes, and I'm building that into my targets. Once we built a picture of our communities and their needs, I very quickly learned a lesson about boundaries and saying no. We ended up with loads of avenues to explore and loads of groups that wanted to work with us. But as a team of 2, I had to be realistic of what we could actually commit to. And I learned this the hard way by committing far too much in the beginning and simply working way too much. I'm now really mindful of saying no, but it is really hard. I think we've become so accustomed to having to seize every opportunity and almost conditioned by a fear that if we say no, the world might end. But I've only found positives really in the power of saying no. In most cases, if that relationship or project is right, there is always an opportunity to find dates and timings that work for everyone involved. For us, it's also really important that we don't lose sight of our USP, which is our collections. We make sure that we use our collections in some way in all of our programming. We use object handling and storytelling, but also use the collections creatively, sometimes as a stimulus for mindfulness, for art, or as a springboard for creative writing. I'm also really conscious about the ethics of engaging with some audiences. Increasingly, museums are entering into working with new audiences, often with challenging needs. And our work is incredibly valuable, but it is not a replacement for statutory service. We don't always have the correct expertise for some work. So although I equip my team with training, sometimes I've had to say no to programming when we aren't the organisation best placed to deliver it. All of our work is driven by partnerships, and some of these partnerships have arisen when we don't have the expertise to deliver a particular programme. So that might mean reaching out to people that are mental health specialists where we've needed that extra backup. The partnerships also enable us to enhance our existing offers rather than walking into a community and trying to reinvent the wheel. We don't always have to start from scratch or be in competition with other providers. We can work with them. An example of one of our most successful partnerships is our work with older adults experiencing isolation. There's an incredible charity in Doncaster called Befriend, and they run social clubs for older neighbours. The groups meet across the borough and aim to provide activities that are fun and are based on building connections. They have a rule that activities for older people don't need to include bingo. We approached them initially as we wanted to develop our understanding of the needs of that audience. We also love their ethos. I also don't like bingo. And we liked their desire to break the mold. We struck up a partnership to deliver monthly activities at their club, forming History Club, where we take over every month. And each month we take collections objects on topics chosen by that group and challenge the older neighbours to a variety of hands-on activities, which has included me being turned into an Egyptian mummy. We've also made Roman perfume, we've done May Day dancing, and we've operated on a Civil War casualty. For befriends, they are able to provide something different for their audience, and for us, we began to understand in loads of detail what those older neighbours need, and we're kind of getting bums on seats, which is what we need as well. Our partnerships have also enabled us to deliver dynamic programming we wouldn't be able to do. So Taste of History, I wouldn't know where to start setting a fire, so they kind of help us out there. Our partnerships are also really crucial for advocacy. We collaborate with a local theatre and community arts organisation to deliver a joined-up programme called We Create, and the programme gained funding directly from the CCG to pilot what arts on prescription might look like for Doncaster. We would not have got that funding individually. We only got that funding because our voices were far stronger together. So my top tips for partnerships, based on things I've done wrong. First of all, make sure the partnership is mutually beneficial. Are you both getting something out of it? If you're not, it's not a partnership. So this might mean letting go of someone that's a partner or reevaluating its purpose. And again, that can be quite challenging. Secondly, ensure you set up partnerships with people that have shared values with your organisation. You don't want to clash on the basics further down the line. And thirdly, create some sort of partnership agreement. This doesn't have to be a really long formal document. I work for a local authority. We love long formal documents. But increasingly, our partnership agreements are conversations over coffee, where we simply write down what we both bring to the table. It really helps those partnerships be more than personality-based. They are then based on your organisations, not individuals. So next, I know I'm running over time, so I'm going to just... I'm good, cool. Piloting. Something about calling a session a pilot gives you the freedom to kind of balls it up a little bit. And our best lessons have come from things we haven't got right. When things have gone wrong, we've been able to have really honest conversations with our partners, with participants, and strengthen those relationships with them. Things that have gone wrong include the wrong choice of venue, the wrong level of activity, the wrong time of day for the session, and we build loads of piloting time into our programming plans and then evaluate the pilot before going live. Something else I've learned is to have the confidence to admit when something just isn't working. It can be really hard when it's a great idea and you've spent ages laminating all of the resources. But sometimes it isn't the right thing and you just have to let it go. Evaluation advocacy. People ask me loads about evaluation. People want to know what evaluation metrics we use, what toolkits I use. And my big tip for that really is to think about why you're evaluating, who are you advocating to, and what do they need to know. So in the beginning, Doncaster CCG said, we know there's loads of national statistics about how great culture is and well-being. What we want is the Donny example. So they wanted Doncaster-specific statistics. So we set about creating well-being tools. So we used an adapted Warwick-Edinburgh scale, and we dutifully went and got everyone to fill those out, and we're able to produce really snazzy infographics about that 20% increase in confidence. But now, 5 years down the line, the CCG doesn't need that. They know that culture makes a difference on well-being. So does the NHS. It's built into their 5-year plan. They know it's there. So instead, what they want is case studies. So we now spend most of our time working on creating case studies that show that real human impact of the work. It's Increasingly difficult as well to interpret our wellbeing questionnaires, because since the middle of 2020, those statistics are really skewed by the pandemic. There is such a high level of anxiety and poor mental health that it's quite difficult to see the impact that your program is having on an individual, but it's still there in the case studies. We've also started doing quite a lot of ethnographic evaluation, and this has been really useful when trying to explain to someone how a session feels. It's quite difficult to kind of sum up what happens in one of these sessions unless you're there. So what we do is we ask a project partner to come in and they write down everything they notice. So that might be that Brenda's sharing her sweets, or someone's put lipstick on, so obviously it's their big day out. And we use those things to explain how a session feels. And then I'd really advise thinking about carving out time for advocacy. It's always one of those things we do at the end. We always evaluate and then try and scramble for funding because we need to get more. But build advocacy into your program throughout the year and have kind of different levels of it, and create your elevator pitch. So if someone says, "What is your project?" that you can say it in 2 sentences. And finally, my final tip is about the importance of looking after the staff that do this work. I'm going to share some of my personal experience and how it shapes our approach in Doncaster. During the pandemic, we moved much of our existing programming online where we could. So that meant that I was delivering her story from home. And after a few weeks, I found that being in participants' homes meant that I found myself carrying so much more concern about their mental well-being. I could see when they hadn't done the washing. I could see when things were piling up at home. And I think all community engagement professionals can relate to some of taking the job home with you. It might be that last minute laminating at midnight, or it could be processing some of those stories that participants have shared with you. The pandemic really shone a light on this for me, and I reached out to people in my network and kind of tweeted into the ether, hoping that I wasn't the only person feeling this. And I very quickly found a network of people in Yorkshire who were feeling it too. And this group inspired us to tackle this on a bigger scale. So we've since set up Glam Cares, which is a care and support network for community engagement professionals. You can come and see us at 2 o'clock today in Museum Mix. We're just over there. But it's essentially simply a fact that we can't effectively engage or hold spaces for vulnerable audiences if we're not looking after ourselves. Other sectors, I'm thinking of art therapy as an example, build in supervision for their staff in project planning. Often museums aren't thinking about what staff might need when they engage with wellbeing work. We will risk assess the experience for our participants and will train our staff in what we think they might need, but we don't always factor in the mental health risks for staff as well. We need to ensure that our programs consider what our staff need to deliver them successfully, including what they need to look after themselves. What this is meant for my programming is I've changed how we approach one-to-ones and team check-ins. We have regular moments of joy days where we reclaim some museum joy for ourselves. We go and visit other heritage sites and remind ourselves why what we do is so blooming wonderful. We also have really regular reflective practice sessions, and we speak really openly about things that have affected us in our sessions. I have a budget line for self-care, because I recognise that my team are the experts in what they need to look after themselves. So they can access that budget at any time, and that might be budget for a supervision session, it might be that they really want to buy a mindful embroidery kit to give themselves a bit of headspace, or it could be a book on stress management, whatever they need to look after themselves. And considering the impact of staff wellbeing has also really reinforced the importance of boundaries for the work that we deliver, thinking about whether we're really best placed to deliver that kind of work for our audience. So that rounds off what I wanted to say. When I'm looking to the future, I'm looking forward to developing more of this work. So we're looking actively for new partners, and because we're now a kind of core funded service, it means I have the luxury of being able to fall back on time. But we're developing it further with our youth program. So one of the things that's really come out of data in the past year is the impact the pandemic has had on youth mental health. And our clinicians are finding it really hard to find answers to what they can do for young people. Young people aren't wanting to go to the youth club, and that isn't really helping how they feel. So we're exploring in different ways. One of the things we're doing at the moment is a program with young people who are experiencing kind of disordered eating, and we're using the kind of cooking on fire stuff to kind of work through some of that. I'm here if you want to ask questions. I'm very aware it's lunchtime and everyone wants a sandwich. Yeah.
Whoa.
Oh,
1 minute, 1 minute.
oh, sorry.
Can we have a big hand, please? Come on for Victoria here. Thank you. We have loads of time for questions, and we have a microphone. So if you put it up close, yeah,
No
and
pressure.
then I'll repeat it.
Sorry about before. I was wondering how many people did you manage to engage with during for each program,
Yeah.
and how many during the year?
Okay,
Thank
so
you.
so the question was how many people do we actually work with, basically. So it varies on the session. So we limit our digital sessions to the maximum of 12 participants because more than that, people can't have a conversation. Our in-person sessions, the maximum we would be able to accommodate is 40. Again, that's just to do with space and to do with people actually having a meaningful conversation. Over the year, we work with about 2,000 people a year. And that's kind of a mix of online and in-person programming. That also includes when we drop in someone else's session, so when we hijack someone else's stuff. So.
Any other questions, please? Anyone at all? No? Really, no?
People
Yes,
usually
great,
ask me about
thank you.
social prescribing. No one's done that yet.
Hi, I was just wondering, I'm from a local authority museum as well, and I just wondered if you tapped into any other local authority departments to help you with that initial research and things?
Yeah, so the question was that they also work for a local authority like me, and they wanted to know if we tapped into any of the departments, and the answer is yes. So we worked, in the very beginning, we worked really closely with public health. So public health had a lot of the stats that I stole. There was no point in me trying to work out what the need was. It was already there. They'd already produced the Joint Strategic Needs Assessment and all that kind of stuff. So we work really close with public health. We also work really closely with the community engagement teams because they have people that beat the streets in their communities. So they were the ones that said, you must talk to Brenda in the shop. They kind of identified those kind of community anchors for us. We also, though, work with adult and family learning, so kind of from the learning team, and people that have been really helpful as kind of environments and street scene have become my best friend to be able to let me use parks for free. So I kind of busy myself. I turn up at lots of meetings in the council where heritage seems really odd and people can't work out why the museum's there. But it's the way that I kind of introduce this work that we're doing and find those potential partners. So get yourself on agendas. Go and talk to people.
Any other questions? Any others? No? Really no from the floor? Okay. Thank you very much for the session. Before you go, you have 5 things to do. One of them is please come up and talk to Victoria if you've got any questions for her. If you have an idea or a half idea for a session that you'd like to share with the sector for the M&H show next year, come up and see me, and it doesn't have to be fully formed because this only works if we all share the work that we're doing with the rest of the sector. Do come and see me if you want to talk about improving the visitor experience. That's what I do, but I'm also around the show tomorrow, so you might bump into me there. Drop M&H show a line. They have they're really simple email address, info@museumandheritage.com. That's a pretty straightforward one. info@museumandheritage.com. Please drop them a line. And the last request is for everyone, so please can you clear the room for the next session. We have the National Lottery here at 1 o'clock, so hopefully see some of you then. Thank you very much.